The following is an overview of the individual shopping experience on our HCSC websites beginning October 1st, 2013. We will be covering two features in the demo: Shopping Guide and Retail Shopping Cart. Shopping Guide was created to help educate and assist a user with the shopping process. We will begin the overview with this guide. Then we will review Retail Shopping Cart and the enhancements that have been made to support the two shopping experiences for October. First, a user who wants to purchase an off-exchange plan, which is very similar to our current process in Retail Shopping Cart. Second, a user who wants to estimate a premium credit, also known as subsidy, and enroll in an on-exchange plan. Now, we will launch the demo for Shopping Guide. This is the first page that a user will see when navigating to the Shopping Guide. It provides an overview about the guide as well as the 4 key topics that are going to be covered: before you start, your plan options, save money, and start shopping. It also has a launch point to Retail Shopping Cart from here to view plans and pricing. Let's take a look at before you start. This screen offers an overview of healthcare reform, the top things to know, as well as the enrollment options that a user has when purchasing a plan. This page also offers the opportunity for the user to navigate to our other site, Healthcare Reform and You, to learn more about healthcare reform. Your Options provides an overview of plan information that is important for shopping and enrolling in a plan. First, it lists the essential benefits for qualified health plans. Next, it provides detailed information around plan levels, also known as metallics. These metallics include bronze, silver, gold, and platinum plans. The guide also provides information on networks. It distinguishes between the PPO networks and HMO networks. It also helps the user to understand out-of-pocket costs as they relate to deductible, coinsurance, and copay. Lastly, the guide has information on prescription drug coverage as well as dental coverage. Save Money helps users understand premium credits and cost-sharing reductions. It also helps users identify who may or may not qualify for these credits by using the illustration as a reference guide. For users who know they qualify for a credit, the guide also has the opportunity for the user to select to go to the exchange and complete their official application. Lastly, the guide offers next steps for the shopping experience. The user can either select to view pricing, which will launch Retail Shopping Cart, or we provide information on calling our agents. For this demo, we will select to view pricing and launch the Retail Shopping Cart portion of the tutorial. When launching Retail Shopping Cart, the user is directed to the census page first. This is where the user enters details on the applicants enrolling for a plan. These details include the zip code and county. Depending on the user's zip code, the county will be pre-populated. If a zip code maps to multiple counties, the user will need to select the county from a predefined drop-down menu. The user will also need to enter the sex, date of birth, and tobacco use in order to get a quote. We've also added a new link to the census page here at the bottom for a user who has already completed the eligibility application on the marketplace and has received their eligibility results. By clicking this link, it would prompt the user to either log in to an existing shopping account or create a new one. This would allow us to retrieve the results from the exchange for the user and help continue the shopping process. There are also links on the census page for the user to either shop for a short-term plan or view Medicare plans if they wanted to do so. For this demo, we're going to assume that the user has entered the census information and selected Next. This is a new pop-up that we've added to Retail Shopping Cart. It introduces the idea of a premium credit, also known as a subsidy. It provides a little bit of information about what a premium credit is, and it also provides this reference guide to help a user decide whether or not they may qualify for a credit. In this demo, we're going to assume that the user has selected No. By selecting No, it directs the user to the Plan Results page. This page displays all available off-exchange plans that the user is eligible for. The default sort order is by premium from lowest to highest. You can see that there are also some new indicators on the plan results, such as this one, Bronze Plan. This helps the user to identify what type of metallic or benefit level that this plan is. You can also see that the plan names have changed a bit. The plan names now include the metallic level as well as the network, such as Blue Community Bronze, HMO 5. From the plan results page, the user can still select to sort by a different order or change the filters on the left-hand side of the page. You can see that we've also added some new coverage features that correspond with the new plans that are available. We've also added this benefit level so that the user could change which type of plans they're searching for. At any point in time, the user can always reset the filters to get back to the original list. At the bottom here, this new button, Check to see if your doctor is in the network, would launch a new window for the user to search for a doctor and which network that doctor is in. We've also added a new button at the top here, Help Me Choose. By selecting Help Me Choose, it would open a new window over this page and ask the user a series of 5 questions. These questions just help to filter the plans that the user will see. It asks the user such questions as, which is more important, a lower monthly premium or a lower out-of-pocket cost? Again, this is just to help the user with the plans that are displayed on the screen, and the user can always select to reset the filters at any time. The user can also select to find an agent. This is how a user will associate an agent with their session in Retail Shopping Cart. You will see this search function on several pages as we go throughout the demo. Our last feature that we've added to the plan results page is this system-generated message here. This message is to help the user, again, decide whether or not they may or may not qualify for a credit. The dollar amount that you see here is dynamic and dependent upon the census information that the user enters. Let's assume that the user has selected an off-exchange plan. Selecting an off-exchange plan will launch the confirmation page. First, the user will need to select dental coverage. Under the Affordable Care Act, a person is required to be reasonably assured that each member on the plan has the appropriate coverage for pediatric dental services that are essential to health benefits. So the user must select one of the following options. Enroll in a dental plan that's available for adults and children. enroll in a child-only plan to help meet that requirement, or confirm that they already have the appropriate dental coverage through another carrier. The user can also select to view the dental benefits associated with the plans that we have available. Next, the user can review the plan that they've selected, as well as the people that are being covered on the plan before they start the enrollment form. We also provide a list of information that the user will need before enrolling to make sure they have everything that they need before starting the process. There's also a confirmation here that we've added that the user is not selecting to use a credit for this plan. Selecting Continue will launch the enrollment process. First, the user will need to read the terms and conditions and agree before moving on. Next, the user will complete any additional information about the applicants, such as telephone and mailing address. This would be for the dependents and spouse as well. Next, we will gather any other additional information needed, such as any information on current Blue Cross and Blue Shield plans or information on replacement of coverage. Then the user will need to select a payment option. As you can see, the options here are through a bank account, credit card, sending a check. The user also has the option to select Bill Me Later. Depending on the date of the enrollment and how far away the effective date is, the user may or may not see this option. Lastly, the user will need to review all of the signature portions of the page as well as provide the electronic signature before completing the application. Upon doing so, the user will be directed to the finished page. This is the last page of the process and offers the opportunity for the user to print the application and coverage details for their records. This completes the enrollment in an off-exchange plan.